I'm at the Europe Now show, and I'm talking to John, who's going to tell me about a medical testing device. It's called
HRV.
HRV.
That's heart rate variability. Heart rate variability. It's uncommon. It's not. People don't realize this, but a steady heartbeat is not necessarily the sign of a healthy heartbeat. There are slight microsecond and millisecond changes in what they call the RR intervals, or the, if you've seen the EKG pattern, the big hump to the next big hump. Okay, and by measuring these differences, we can actually get a very, very good picture of the autonomic nervous system. This is the Nerve Express, as developed by Dr. Alexander Riftin. Dr. Alexander was a Soviet naval officer whose job it was to screen fighter pilots for their adequacy to be able to handle the G-forces as a pilot. Because if you're going to train somebody at the cost of millions of dollars to fly $1 billion plane, you better make sure that they have the physical abilities to be able to handle it.
Okay. So tell me more about these variations.
Okay, there's 3 different types of tests that are actually used in this. The first is an orthostatic test. It's very simple. A person lies down on a bed, you get a regular heartbeat, and then after a period of time you ask them to stand up. Now when a person lies down, the blood vessels vasodilate, the blood vessels open up. When you stand up, in order for the blood to get pressured enough to go up to the head, the blood vessels have to do what's called vasoconstriction. That natural function is what we call the part of the autonomic nervous system, or the automatic. It's just like when you sleep, you don't remember to breathe, you just do it automatically. So there's 2 parts to the autonomic nervous system. I like to call it simply the parasympathetic, it's called the sympathetic and parasympathetic, but I like to call it the gas and the brakes. It's, for example, how fast can you do the 100 yards, but how quickly can you recover to do another 100 yards? That's the parasympathetic, that's your recoverability. So you have what's called your health factor, and basically then your adaptability. So that's the orthostatic test. The second test is a very interesting test in that it's just sitting down, you hold your breath, you take normal breaths for a period of time, then the patient is asked to hold their breath, and then the patient is asked to do some deep breathing. This stimulates normal breathing. It simulates also conditions where if the saber-toothed tiger is chasing after you, we kind of hold our breath. So that's actually stimulating adrenal challenge. And then basically you have the final portion, which is more the healing, and this is actually quite interesting because we see the healing effects of deep breathing, filling out the lungs and emptying it out. And then finally, the third aspect is real time, measuring the sympathetic and parasympathetic based on various criteria. One of the interesting things is this device is really the only device that can give us objective evaluation of a person's hypersensitivity to electrical stimuli. In other words, what they call hyper-electrosensitivity, which is being heard about quite commonly in the news due to all the cell towers. And it's been proven over and over again using this test that we can actually have a person with double blind study that
would show if they're
if they're affected.
Wow.
If they're affected by it.
Never heard of something like that.
And it does
there is no other way to do it.
And it does that by actually measuring the changes happening within the patient at the parasympathetic and the sympathetic levels.
The cardiac level.
And and we measure the heart through the autonomic nervous system. So it's giving us that information, which is really good.
Can you tell me what these variations are, like you talked about?
Okay. This is one of the graphs that I like to look at. I'm a chiropractor and osteopath. I do different techniques for regenerating people with MS, Parkinson's, stroke. And by using this technology, I use that in combination with a technique I'll call biocranial, which is a 2 to 3 minute procedure, which releases the dura from the skull all the way down to the toe. So using biocranial, we can actually measure the changes happening here. So I like to do it in real time. We had a patient, let's say with Parkinson's. This is an example of him here. You'll see that there are 4 quadrants here. When you're within the -1, +1, etc., right in the middle, that's normal. If I come over here, this is healthy. This would be also your elite athlete, also down here. Here's where you're starting to see stress patterns. People that are under stress, having trouble recovering, hyperthyroidism, hypothyroidism, and down in here, this is a really important one because this is where we see degenerative changes like Parkinson's, cancers, any of MS, any of those types of issues. So the gentleman who had Parkinson's, he could easily have cancer too. We see that he's right down here by the -3 and -2 levels, which is not good. So what we want to do, and this is the blue is where he's lying down, and then the green is where he's standing up. So what we want to do is we want to shift that. This is the parasympathetic axis, this is the sympathetic axis. So the further off you are to that side, that means he's having trouble recovering. Whether that doesn't matter, whether it's Parkinson's, cancer, if you have a really bad cold. We want to shift that over to the middle. So using the biocranial in real time as I'm applying the direction of force on the skull, we were actually able in real time to see what was improving it. Normally I do it on 2 sides. When I did it on the one, it made the parasympathetic improve. When I did the right side, it made the parasympathetic get worse. I went back and did it where it improved. It told me we have to just do one side. And so after when we redid this test, the orthostatic, John, can you bring that in?
Just a comment, by the way, we did this real time. This test, as you see, was done at 11:59 on 9/18/2012. This here is after the doctor did the treatment, okay? You can actually see this was done at roughly 1:30, and it was tested again, and here's the change. You can see how the upregulation of everything, even into the positive and healthy
and you'll see he went from -3 to -2, and then he shifted over into this area, and this is where this is a good
really
place
where you want to be.
And then we did the and he came back a week later, and he could sleep for the first time throughout the night for 7 hours. He hadn't been able to do that in 7 years. And
couldn't sleep in 7 years, and now he can.
7 years for actually, he came on Tuesday, and it lasted, the one treatment lasted until Saturday afternoon. Saturday evening, he again started having issues. But this was the first time in actual 8 years, it was 8 years, he hadn't been able to sleep through the night once. And he actually, Tuesday night, Wednesday night, Thursday night, Friday night, he slept through the entire night.
And he had what disease are you saying?
This was Parkinson's.
Parkinson's.
Now sometimes...
Is that a common problem with those people?
Yes. And a lot of times with Parkinson's, it can follow a head injury, which he had had. So that made sense sometimes about just doing the one side for him. So for anybody with head injury, again, it can
Stroke.
be any stressor to the nervous system. When we're seeing it down here, we want to get you out of that. Even if you have cancer and you're going through treatments, you want to get that up here because it's the body has to be able to heal and recover.
It's immune system.
Yeah, it's all geared through the nervous system.
What else do we need to know?
Did you do the other one after the Avasia?
No, this was after the biocranial. This was the very last one.
Okay.
We actually, just to show you, actually I skipped a step. I apologize for that. Dr. Monica, she always does biocranial, and quite often she'll finish it off with an Avasia, a special technique that we use with the Avasia that helps lock it in. This, I'll just go back. This was where when the patient came in. Right here.
So before we did
anything, this was after. This was so. This is 11:59. So at 12:56, we actually we had the person do rest, and then we did she did the biocranial. And here's the improvement just with the biocranial.
I also did the light therapy and the neurological upregulation of the 12 cranial nerves.
So she did what's called neurological rehabilitation, and this is where we got that with just the manual treatments as well. And then basically, finally, after we did the Avasia, this was the final treatment, which is actually incredible.
Phenomenal.
That is critical. So it's on the right quadrant that you want.
Yeah,
We
and
went
this-
from chronic degenerative to a healthy state.
And how long will that stay?
Well, like
he
I
was
said,
good for 5 days, symptomatically. He felt wonderful, and that's where he could sleep. So he came back then the next week. He had just the last 2 days a little bit more trouble, and then we did him again on Tuesday, and he's again feeling much better.
Yes.
And this will be an accumulative, like each
So
visit will build
get
up on
better
the
and better.
So it's more as you keep that person in that quadrant, say they
You've
come
got
back
it.
every 5 days because it was holding for 5 days, then they will never be in a negative, which gives them great potential to heal because they're at the healing quadrant that
Well,
you
we're-
want.
yeah.
So you
Exactly.
can't get sick at the
What we're
at that
measuring here-
quadrant. It's showing you your body's going into healing.
And in fact, he didn't even necessarily have to tell me that he was going to feel better, because this tells me. This
Exactly,
is the
that's your
science
feedback.
behind it.
but the interesting thing here is, and this relates to what you were just saying, Marcus, you'll see on this axis, we've got a good parasympathetic. We went from all the way -3 to +4. What that means is that's your adaptability, your ability to recover, which basically means, having said, noticed that it actually lasted Tuesday, Wednesday, Thursday, Friday, right up to Saturday. That's 5 days where
And
he
5
had
days
an
of sleeping.
elevated of parasympathetic, and we know that good sleep is vital to healing.
For your immune system. That's when you get that's why the doctor says go to bed early, get some sleep.
If we, and this is
Back
why
in the
this
days.
is cumulative.
You
Yep.
Now it's fashionable to be up late at night and do Twitter, Schmidt, and go to concerts, but people don't realize from 10 p.m. till 2 in the morning, I believe, is when
It's
your
your
immune
mind.
system kicks in.
Yep. Yep.
That hence when we didn't know then because we're kids, get some sleep or get some, doctor would say, prescribe, get some R&R. That's why. So now you can actually prove
So
before and after with this technology.
This is exciting because it also directs me as a practitioner in terms of what I need to do to help him and what I need to do to stay away so I don't make it worse.
And in the real-time function, which I think actually I may be able to.
I got it.
Here's the monitoring.
gotta cut.
Okay.
It's okay, keep going. You're just going to wrap up
Here's
here.
here's a section of the monitoring. It's only a short section, but you can actually see this is where over intervals. This is just I have to show you. I don't have a good sample of the real time.
But why don't we go into, you're with the Healing Center, right?
Yes.
Tell me more about that.
The Healing Center was developed or been in business since 1995 officially as the Healing Center, and we do lymphatic drainage. I'm a chiropractor and osteopath. That is primarily what I do, as well as nutrition. And as a practitioner, I'm doing Thompson technique. I do a little bit of sacral occipital, biocranial, again with degenerative conditions. I find really works well, excellently actually, and quantum neurology, which is an upregulation of the 12 cranial nerves using pulsed light, which is very, very effective as well. Anybody that's had head injuries or neurological, you got to get that back up there. So, you want to say something?
Well, I fell into being an assistant for Dr. Fallhaber in that she actually says, does that work? And with my engineering background, I actually do the due diligence and actually find out, is it woo-woo technology or is it real science? And this is how we found this, like the Avasia, and I've been blessed by meeting wonderful people and excellent products. And what we do is, by using the products in our clinic, we can actually market these products. I market these products with integrity, knowing that they actually work.
Good. I noticed on your computer there, I'm seeing these, what are they called? And then spaces, and that's what you're talking about, the heartbeat?
Yes, these are the intervals. They're stacked very closely together because we're talking roughly anywhere from 600 to 800 milliseconds between each space. So this is really a wide series because this is real time. These are intervals that are actually measuring whether the sympathetic and the parasympathetic go up and down.
Right.
In the orthostatic test, you'll see that there's a reading when you're lying down. There's a little dip as the body regulates as you stand up, and then it re-regulates. And through that, we also get. This is something I never showed you, but on the orthostatic we also get a fitness indicator. Here you see originally there's a degree of a level of wellness, which this gentleman when he first came in was 10 and 7.
So this is the worst, 13 is the worst.
And 7 is the worst.
Yeah.
Okay, so in this case, this was actually one of the early ones, and then if you go back here and take a look at the last orthostatic test, and we take a look at the fitness. Oh, sorry, I got this right here. Hold on a second.
This is also for athletes will measure whether they're overtraining. And if you have sometimes in marathons where someone dies, if they're pre-screened for this, you can find out who that person could be.
Oh, really?
Yeah.
And then afterwards you could see, like in the chart, you see the adaptability has increased.
Great. Okay, website for more information?
Yes, you can actually find more
For this
about,
particular product and then maybe the wellness, the healing center?
You can actually see Nerve Express in Canada. I am a dealer for the Nerve Express. Nerve Express is a Health Canada approved medical testing device. Heart rate variability is used quite often, very often in hospitals all over the world now. It is accepted technology, and you can look at Google Nerve Express and Dr. Alexander Riftein under Heart Rhythm Instruments.
Great. And the Healing Center?
The Healing Center, we're at The Healing Center with an RE.ca, and you can contact me at Monica with a K at The Healing Center, and John through Nerve Express at Akanom, which is my name spelled backwards, .ca, because I figured if it's good enough for Oprah, it's good enough for me.
Great.